All right, ready again? So I'm sorry? Yes, thank you for reminding me. Yes. So we're going to start off talking about the alarm phase. And we have this perception of stress. Something has stressed us out. And let's say, again, this is going to be a short alarm. So, again, you see a rattlesnake, you're scared, and you're stressed out. As soon as you have that perception of stress, or even fear causes a stress, that perception in the brain is going to be sent to the hypothalamus. Now, immediately, the hypothalamus says, okay, we've got to react to this. Something has to happen, and it needs to happen very quickly. So we have to have a very fast response. So the hypothalamus is going to create this fast response and do it by stimulating the sympathetic nervous system. Now, the sympathetic nervous system is a little different than the other types of nervous system. We know this is part of the autonomic, but the sympathetic nervous system, so if we're looking at, let's say, a neuron from the sympathetic nervous system here, okay? This neuron is going to release a neurotransmitter, which is called norepinephrine. This is the neurotransmitter released by the sympathetic nervous system. This is norepinephrine. Now, typically, we've been talking about the fact that once a neurotransmitter is released, it binds to the next postsynaptic neuron, but not norepinephrine. It does not bind to another neuron. Instead, norepinephrine will bond to different types of organs. And the reason we want norepinephrine to bond to these different organs is so that we can create an effect. So you see a rattlesnake, you need to have some kind of an effect. You need to be able to say, okay, I need to get away from here, I need to kill it, I need to do something. I have to have an effect. Just standing there staring at it while it's ready to bite you is probably not a really good idea, especially if you're close. At least back up. Okay? So whatever organ the norepinephrine binds to, we refer to this as an effector organ, because we're going to create some kind of effect. So now let's think about, maybe this year you get to go to Not Scary Farm and they really do a super good job with that haunted house. And you're walking through this haunted house and people are jumping out at you, and how do you respond? What happens in your body when they're spooking you? What do you do? Not like you haven't had somebody jump out and go boo to you before. What happens? Okay, so you can scream. What else? What's going on with your body? You may freeze. Okay, so let's call that muscle contraction. Because do you know that the people that work in that haunted house, they get hit a lot? Because a lot of people do this, and a lot of people do this, okay? Kind of depends on how you've been taught, how you react, but it's still considered muscle contraction, okay? What else happens to you?
Your heart rate goes up.
Heart rate goes up. And by the way, whenever that heart rate goes up, you're going to have an increase in blood pressure. May not realize it, but you do. Now, what else?
Gas.
Say it again?
Gas.
Okay, let's call that increased respiration. So some people will breathe faster, some people will breathe deeper. Just kind of depends on the person. What else? Pupils dilate. What did you say? We'll call that relaxation of sphincters, because it may not just be urine. Okay, what else?
Run.
We'll call that muscle contraction as well. Now, by the way, you're afraid. You're running from these people screaming at you. There really isn't any time for you to worry about reproduction. So you may not be thinking about this, but you have a decrease in reproduction abilities. Usually the last thing you're thinking of is, ooh, I'd like to have sex right now. Yeah, usually not doing that. Also, there's a decrease in the immune response. Not real good with repair, not real good with the immune system. Anything else you can think of?
Digestion.
Ah, yes, your digestion goes down. Remember, digestion is all about the parasympathetic nervous system. So sympathetic is up, parasympathetic is down. Okay? That's why you feel like you got to throw up. What else? Anything else?
I might pass out.
Pass out? Why? Usually because you're holding your breath. So we'll just leave it at respiration. Oh, one more I can think of. Increased perspiration. Decreased salivation. Ever given a speech and your tongue's like sticking to the roof of your mouth? That's a pretty good list. You guys, I think you have the best list so far. Okay, that's a really good list. So these are all happening to us during the alarm phase. And this is all because norepinephrine is binding to all the different organs to create these effects. So it binds to muscles, causes them to contract. Binds to your heart, causes the rate to go up. Increases respiration, causes your pupils to dilate. These are all happening because of norepinephrine. So we have our perception of stress. Somebody jumped out to say boo. And now the hypothalamus stimulates the sympathetic nervous system, which just happens very, very quickly. And the sympathetic nervous system releases the neurotransmitter norepinephrine. Now norepinephrine is going to bind to all these different effector organs to give us the effects we've listed here. And you know, you feel those effects. Now, if I'm in this scary house, how long do the effects last?
As long as you're in there.
As long as I'm in there, right, exactly. So when I walk out, do I still have the effects? Maybe for a little while longer, okay? You're a little hyped up afterwards. But how long does that last? Just till you go back in, right? Okay. So it starts to fade after a while, and it usually fades pretty quickly when it's this type of a stress. You know it's not going to be a stress that's harmful to you. So typically this fast response doesn't last long. So it happens very quickly, but it can wear off. So maybe it only takes a couple seconds to wear off. Maybe it takes a couple hours to wear off. Just kind of depends on what the stress was. But it will wear off. You're not going to be totally stressed out like you were when they jumped out in front of you when you walk out the door, okay? So when we're talking about the nervous system being stimulated, it is not going to be long-lasting. So we say that it is short-lived. Any questions so far? Okay, well, how about about this? What if maybe it's not a scary house that's stressing me out? Maybe it's something else that is starting to stress me out that's a little bit more stressful than a scary house. So maybe I'm coming up on this one day where I have exams, and I have like 3 exams on the same day, and this is going to happen in the next 2 weeks. And I'm stressing out about it. Well, this response here with the sympathetic nervous system releasing norepinephrine is the type of response that happens very quickly but usually fades pretty fast. But what if I have to stress out for a couple weeks? What am I going to do? And by the way, that stress, is that at all helpful to you that you're stressing out about these exams? Heck yeah, it is. Absolutely. Because one of the things it does is motivates us. A little bit of stress gives you a little bit of motivation. It's just too much can be harmful. But, so now this stress we've got, hopefully we're using this to motivate us to study more because I'm stressed out about this. But this response is not going to be good enough for me. So now I got to do something else to help me to have the stress a little bit longer so I can continue to be motivated for my exam. So this time, the sympathetic nervous system is still releasing norepinephrine, but specifically, our norepinephrine is going to bind to the adrenal gland. So the adrenal gland sits right on top of the kidneys, and it has 2 parts to it, if you remember. We have a cortex, which is the outer portion, and then we also have a medulla. And norepinephrine is able to bond 2 cells in the adrenal medulla. Okay. So let me just say this to you, because this is important for you to understand. Anytime I want a fast response, I'm always going to use the nervous system to give me a fast response. But if I want a response that doesn't happen quite as fast, but it can last a much longer time, I'm going to use hormones. So in the body, the nervous system, it can happen very quickly, but it doesn't last very long. Hormones take a little while to gear up, but they can last a long time, and we're talking years. It can last in the body. So now I'm going to be stressed out for 2 weeks. Is the nervous system going to be good enough for me? And the answer is no. I need something that will last a much longer time. So what I'm going to do is get the adrenal medulla to release some hormones that will help me out. Now remember, we talked about the definition of hormones. This is a chemical that has to be able to get into the bloodstream. So it's secreted from a gland, gets into the bloodstream, travels someplace in the body. That's basically a hormone. So now watch, this is very strange to most people. The hormone secreted from the adrenal medulla into the bloodstream is called norepinephrine. So norepinephrine came from the sympathetic nervous system, and we called it a neurotransmitter. We can also make norepinephrine from the adrenal medulla, and we'll call it a hormone. Same chemical. It's just coming from different places in different amounts. Does the same exact job. So if I make norepinephrine from the sympathetic nervous system, I get all these responses, but they happen in a very short period of time. If I get norepinephrine from the adrenal medulla, I get a much higher amount, and I can still get these effects to occur, but for a much longer period of time. So here's the important thing. If the chemical comes from a neuron, we call it a neurotransmitter. If the chemical comes from a gland and goes into the bloodstream, we call it a hormone. It could be the same chemical, it's just coming from different places in the body. If it comes from a neuron, it's a neurotransmitter. If it comes from a gland and goes into a bloodstream, it's a hormone. Diane, did you have a question? No. Okay. the sympathetic nervous system is releasing norepinephrine. This is a neurotransmitter. This neurotransmitter binds to the adrenal medulla. And we actually have two hormones that are released. One is epinephrine. The second, or excuse me, one is norepinephrine. The second is epinephrine. These are both coming from the adrenal medulla. Now you probably have heard of these as adrenaline. Epinephrine is the term that we use in the United States and pretty much everywhere in the world except England. When you're working in the medical field, you call it not adrenaline, you call it epinephrine. There is another chemical called noradrenaline, which we call norepinephrine. So when you're working in the hospital, you don't ask for 2 cc's of adrenaline, you're going to ask for 2 cc's of epinephrine, unless you're working in England, which for some reason they still call it adrenaline. They like to be different. Every place else in the world we call it epinephrine. So when you're talking to your friends, you probably call it adrenaline, but when you're working in the hospitals, you call it epinephrine. So these two hormones are released. They're going to bind to the effector organs too. We're going to get all these effects. And we're going to get these effects. The difference is they're going to last longer. Now I can be stressed out for 2 weeks instead of just a few seconds.
Is this the down regulation?
No.
No.
Nope. Has nothing to do with that. We'll get to that in a minute though. Okay, so if it's just short term, all I use is the sympathetic nervous system and just the neurotransmitter to get the effects. If it's going to be a bit longer, okay, then a couple seconds or a couple minutes, I'm going to add the hormones, epinephrine and norepinephrine, to continue to have these effects. And by the way, I can continue to have these effects for 2 weeks, 2 years, 20 years, 30 years. I can just keep making them until my adrenals burn out. Which, by the way, they will. Any questions? Okay, now, notice all these effects here. They're going to take a lot of energy to have these effects. Heart rate goes up, respiration goes up, my muscles are contracting, I have pupils dilating, maybe I'm running, maybe I'm screaming, whatever it may be. Lots of energy is needed. So while all these effects are going on, the hypothalamus is doing something else as well. So the hypothalamus is releasing a hormone. This hormone is called corticotropin releasing hormone, or what we call CRH. Now this is coming from the hypothalamus, and it's not gone very far. It's just going to go to the anterior pituitary. adrenocorticotropic hormone. There's a word for your spelling books. This is ACTH. It's coming from the anterior pituitary. Now ACTH is going to get into the bloodstream and it's going to travel to the adrenal gland. Except this time ACTH binds to the adrenal cortex. The adrenal cortex releases a hormone called cortisol. So we have three hormones involved here. We have corticotropin releasing hormone, and then we have adrenocorticotropic hormone, or ACTH. We have cortisol. So CRH, ACTH, cortisol. Cortisol is then going to affect the liver. And cortisol is going to make the liver go through a process called glycogenolysis. So remember, we store glycogen in the liver. That's the glyco part. Lysis means to do what? Break down. So we have glycogenolysis, which is the breakdown of glycogen. When we break down glycogen, it turns into glucose. And what do we use glucose for? ATP production, right? And now we're going to have a lot of ATP, which is what we need to run all these effects. Plenty of ATP to be able to run these effects. Okay, so we are now going to talk about what's happening in the resistance phase. So everything we've talked about has the potential to happen in the alarm phase. So again, if it's very, very short, maybe a couple seconds to a couple minutes, it's only going to be the first part. Sympathetic nervous system releases a neurotransmitter. That's it. But if it lasts any longer, maybe up to 2 weeks, everything else that we've talked about is going to occur. Once we leave the alarm phase and move into the resistance phase, here's the problem though. All of this comes with us. So we still are perceiving that we're in a stress, and we're still continuing to have all these responses in the body. Heart rate's going to be up, respiration's up, blood pressure's up. These are not good things to have up for long periods of time. Because typically, think about it this way, you know, if you're living in Africa and you have to run from a lion, stress isn't going to last very long. Because either you get away or you're dinner. So either way, it's short-lived. And really, that's what the stress response is all about. Making sure that something is short-lived. But now we live in a different world where we perceive things as if they're lions, but they last longer periods of time. And now this potentially becomes very detrimental, very bad to our body. So in the resistance phase, the body's looking at all these effects and going, okay, this is not good. Let's try to do something about it. Let's try to lower these effects. And so what we're going to do in the resistance phase is we're going to try down regulation. So remember, downregulation is all about pulling those receptors to the inside of the cell. So I might have these hormones on the outside, epinephrine, norepinephrine, ACTH, they're all on the outside binding to receptors, creating an effect in the cell. But if I pull those receptors in, they can't bind anymore. The hormones don't create any more effect. So the effects of stress decrease dramatically. Even though I'm still making all those hormones, even though I'm still having this response, I'm not feeling the effects as much because downregulation is occurring. We do have one problem here though. Of all the hormones, this one right here, cortisol, this is a steroid hormone. Steroid hormones do not bind to receptors on the outside of the cell. Steroid hormones are made out of fat. They can go right through the cell membrane, and they actually have receptors on the inside of the cell. So let's say this is a cell, and cortisol has the ability to go inside. So here's the nucleus. There are receptors on the inside of the cell already. That's what cortisol binds to. And when it does, cortisol travels to the nucleus, and it can affect transcription, translation, make all kinds of changes in the cell, and you can't downregulate against steroids. Which means now that cortisol is going to be in really super high concentration for long periods of time, and you can't stop its effects. Now, cortisol is a good hormone in lower concentrations. It helps us to regulate blood pressure. It helps us to regulate how much sugar we have in our bloodstream. It helps to regulate our immune system, make sure it's nice and healthy. Helps to keep inflammation down. Does a lot of positive things, but in low concentrations. If you have cortisol in your system in super high concentrations for long periods of time, we're in trouble. So let's talk about some of the effects of high cortisol levels. One of the things that high cortisol levels do, instead of cortisol just regulating your immune system, keeping it healthy, it will depress the immune system. And you've probably, I'm going to guess, have experienced this. Think about this, you know, you get to the end of the semester and all those crazy teachers, they just keep piling things on your plate and you get more and more stuff on and you get more and more stressed out, and finally the final is over and you're like, oh, thank God. And within a couple days you're sick. And then you're like sick for the whole vacation until you start school again. Well, what happened is more and more stress, more and more cortisol, the lower and lower your immune system, you pick up disease really easy. Or my friend I was telling you about that had so many members of her family die in 1 week. What happened to her was she ended up having cancer within 6 months of the breast and had to have a double mastectomy. Now how the heck did that stress cause cancer? Well, the high cortisol lowered her immune system. And if you remember, I told you that our cells go through mitosis all the time, and about 1 every 10,000 times it's a screwed up cell. The DNA has mutated, it's a cancer cell. In a healthy person, phagocytes eat it up, no problem, but her immune system is depressed. It's like she's on immunosuppressant drugs. And so now her phagocytes go, I'm tired, I can't do this job, and the cancer escapes. And she has cancer in both breasts after that massive stress, and has a double mastectomy. It took only 6 months. We were waiting for something really bad to happen. And it did. So this suppression of the immune system can create all kinds of problems, like for instance, even causing autoimmune diseases long term. Cortisol can get into the DNA, and if that autoimmune disease is in your genetics, cortisol can click it on, and bam, you've got an autoimmune disease. So you get stressed out, you can get diabetes. Not from excess sugar, but actually from excess stress. Wonderful, huh? Another thing. affects what we call circadian rhythms. Circadian rhythms are your sleep-wake cycle. So it changes those. So I'm going to give you a test right now, and we'll see if you're in the resistance phase. Now, you don't have to tell me, okay? I'll pretty much be able to tell by looking at you. All right, so here's the test to see if you're in the resistance phase. Does this happen to you? So maybe you've been studying and you're up till 11, 12, maybe 1 o'clock in the morning. You're super exhausted. You want to go to bed. You fall into bed so tired, and you don't fall asleep. You're laying there and laying there and laying there, and you can't get to sleep, and maybe the world is cruising through your head. You're thinking about all this stuff that you haven't gotten done. And finally, maybe 45 minutes, an hour later, you're asleep. Okay, good. And you're sleeping nice and deep. And somewhere around 2:30, 3:30 in the morning, bink, you're awake. And you're wondering, what the heck happened? I mean, there's no dogs barking. There's nothing that should have woken you up. You're just awake. And now, you can't get back to sleep again. And finally, maybe 4:30, 5 o'clock in the morning, you're back to sleep and your alarm goes off like 6:30, and you're like, I am so exhausted. If you're going through that, it's because you are in the resistance phase. And it is cortisol that is changing your circadian rhythms and makes it very, very difficult for people to get to sleep, and then very difficult to remain in a deep enough sleep. Cortisol can bind to an area of the brain called the hippocampus. And the hippocampus is all about short-term memory. And cortisol has the ability to block the storage and or the release of short-term memory. Now, what the heck does that mean to you as a college student? So if you're stressed out while you're studying for that exam, you may not be able to get any of the information to stick because cortisol is blocking the ability for that information to stick, and you just can't remember anything you studied. Or maybe you remember what you studied, but you come in this room and you see my mug and you are stressed out because you're taking an exam that day and the stress is ridiculous that you're feeling, and you can't then get that memory that you've stored to take that exam. You turn your exam in, you walk out the door, bam, it all comes back. Why? Because your cortisol levels plummeted the minute you walked out the door, and your short-term memory could be released. It's like cortisol locks that door and either doesn't allow you to retain the information or doesn't allow you to access the information while you're taking the exam. Just kind of depends on what happens to you personally. Now, here's one of the things that I highly recommend for you. You've got to find a place and you've got to find a way that while you're studying, you are not stressed out. You've got to figure out something that while you're studying at home, in the library, wherever it is, that you can feel more relaxed. Even if you lie to yourself. I'm just having fun doing this. It's no big deal. I'm just doing this for myself. I don't care about my grade. Just keep telling yourself, it's okay, it's okay, it's okay. I don't care about the grade. Just keep lying to your brain. Eventually it'll believe you. It's really gullible that way. But find a way to be relaxed. And then, once you do figure that out, make sure that while you're studying, something is in front of you that you can look at. Now, I don't care what it is. It could be your bottle of water. It could be candy if you study and eat at the same time. It could be a picture of a loved one. It could be a candle that you like the smell of. And make sure whatever it is that you're looking at is also something you can bring into class. So like if it's a nude picture of Thor, not a good idea. Although that does de-stress me. I don't know about you. Anyway. Just saying, okay? Can't bring that into class, no matter how much the ladies would enjoy it, okay? But think about whatever it is that you can bring into class with you. So don't light the candle, okay? Because you can't light it in class. And bring it to class. Because it also fools the brain into helping you to perceive you're not quite as stressed. That way, it helps you to store and retrieve memory. And that obviously is very important. You've worked really hard to try to store it. You also want to be able to retrieve it once it's stored. So you've got to fool your brain into believing that it's okay, you're not quite as stressed out. Now also, here's a very important thing. Do not drink, do not take drugs while you're studying. Because you will then need to drink or be on those drugs while you're in class. I'll give you a for instance. I had a student who, it was very obvious that he was extremely bright. Asked really good questions in class, did a really good job, but when it came to taking the exam, he just failed. Totally bombed the exams. And after the second exam, I was just like, okay, need to talk to him, what's going on? And he told me he was a severe alcoholic. And so he would be drinking while he studied, and then just simply out of respect, he didn't drink before he came to class. And I told him, that's your problem right there. Because you're an alcoholic and you drink while you study, you have stored all this memory in an area of the brain that you cannot unlock unless you drink before you come to class. And he's looking at me like, well, I don't know what to do because I'm not supposed to drink when I come to class. And I said, well, you know, you're going to fail if you don't drink before class. I know you're not supposed to, but you're going to fail. So he did. He had something in the parking lot. He drank before he came to class. He got an A on the exam. For me, it gave me a really good opportunity to talk to him about how this is a problem for him, because what are you going to do when you become a nurse or whatever it is you're going to shoot for, and you have to drink to perform to your best ability. Now, I'm really happy to say, right after that, he went to AA, and he's been clean and sober now for about 15 years. And he is a nurse practitioner at Loma Linda right now. But it's very important for you that if you are, you know, maybe having a little glass of wine before you study or while you're studying, don't. Okay? Because you won't be able to get that information out. Now, not in this class, but like in Bio 107, I've had students who come in and they're totally stoned. And you know that I don't even know what they're on. They're completely stoned. And I had one student, really brilliant. I don't know how he did. He's probably about 30 years old, and he already had 7 kids. Okay? And one mom, 7 kids, and he was stoned every single day he came into the class. He must have been stoned while he was studying, too, because he got a straight A in this class. But he had a severe, severe marijuana problem. Severe. And I don't know if he ever got help because he dropped out of the class. So you have to be really careful what you're doing while you're studying, because it's going to be different when you come into class. Okay? Any questions about that? Yeah.
So what about with like Adderall?
Ah! Beautiful. I'm so glad you asked that. The drug of choice for most college students. That and Ritalin. Adderall is legal speed, so is Ritalin. That's all it is. So if you're taking Adderall for a real serious physiological problem that you have, be real careful with that drug, because it can cause dependency, it can cause long-term side effects. So you have to be very, very careful with it, and you must take it while you're studying, while you're here in class. It's the same exact thing. It's a very serious drug. You don't want to take Adderall unless you've really studied what you're taking. And Ritalin, I know a lot of college students will buy this on the black market and take it so that they can stay up all night studying. Again, same thing. You take Ritalin to study, you better take Ritalin while you're in class, but you won't be able to sit still. It's not a good idea to be taking that drug. That also is extremely addictive. Adderall and Ritalin, very, very addictive. They have to be careful with those drugs. I really don't see our college students on Ritalin all that much. You can really tell because people squirm and fidget and do things like that.
Is it the same thing for like all ADHD?
Mm-hmm. Yep, a lot of kids get prescribed ADHD, the Ritalin, and then they sell it instead of taking it. It's a very big drug, especially on university campuses. Huge drug for college students. All right, so if we continue to be stressed, we're going to go from the resistance phase to exhaustion. Okay, now, one of the other things I want to tell you about the resistance phase when you're working in the medical field, you're going to have these patients who live a pretty stressed out life. They're going to come in to see you, and they're going to complain about things. Like maybe they come in and go, oh, I'm having some problems with my heart. I feel like I got butterflies in there, and it flutters a lot, and sometimes when it flutters I have to cough, and it feels like it's getting the heart going again. Or, oh man, sometimes I have really bad chest pains, and I don't know what's going on. And you help them. They take clinical tests to see what's happening, and nothing is wrong. Or maybe you have another patient who comes in and goes, my stomach, it just hurts me all the time. I don't know what's going on. I just have all these pains. You do all kinds of clinical tests, nothing is wrong. Or another patient comes in, my joints hurt, my muscles ache, I just feel tight all the time. I just feel lethargic, I don't feel good. I don't know what's wrong. Again, you take clinical tests, nothing is wrong. What's happening to these patients in the resistance phase is the immune system is starting to go haywire. And problems are beginning to occur. And it's not that your patient is lying. It's not that they're a hypochondriac. It's that your tests aren't good enough to figure out what's wrong with them. We've got these clinical tests, but, they're good. But for patients like this, they're not good enough. Until one day, this patient has been under stress long enough that that fluttering heart becomes a heart attack. Or that painful stomach that you couldn't diagnose becomes an ulcer. Or those pains in the muscles and the joints and the fatigue become rheumatoid arthritis. Now they're clinically diagnosable. Now the problem has become super bad. Wouldn't it have been nice if you had paid attention when they were only complaining about symptoms and didn't actually have the heart attack yet, and you did something for them, instead of saying, these people are just a hypochondriac. Because your tests weren't good enough. It's not the patient, it's the testing. We move from the resistance phase into the exhaustion phase when the person goes from just complaining about symptoms to actually having the disease. We say that this person now finally is clinically diagnosable. So I have the good enough test to tell it's a heart attack. I have good enough test to tell they have rheumatoid arthritis. Prior to that, in the resistance phase, I couldn't quite tell. They hadn't gotten bad enough yet. My tests weren't sensitive enough to pick up this disease. So again, moving from resistance to exhaustion, the person has become clinically diagnosable. So look, alarm is easy. It's 0 to 2 weeks. After 2 weeks, we're in resistance. Resistance into exhaustion, a little bit more difficult. But now I become clinically diagnosable. You can say I'm in the exhaustion phase. And of course, now that I'm clinically diagnosable, these are problems that could potentially lead to my death if we don't take care of it. Now, sometimes the disease that happens is also in the brain. So people can not only have a heart attack or ulcers or an autoimmune disease, they can have problems in the brain as well. Really, remember, this is a syndrome, and each individual could have potentially different symptoms from stress. And most of the time, our symptoms are due to our genetics. We say it's typically our genetically weakest point. So for instance, let's say heart attacks run in my family. I would be then most likely to have a heart attack with stress. Or maybe ulcers run in my family. then I would be most likely to get an ulcer with stress. Or maybe cancer runs in my family, then I would be most likely to get cancer with stress. So it just really depends on our genetic makeup what symptoms we will have and what diseases we get from stress. And some people, it's going to affect their brain more than the rest of their body. And so what we can see is in some individuals, there's a problem with the neurons, and these neurons, it's believed, don't have the ability to make as many neurotransmitters anymore. Which means if you don't make as many neurotransmitters, you can't stimulate the postsynaptic neuron as much. So what if the neurons that were affected were the neurons that make me feel good, make me happy? Dopamine, serotonin, epinephrine. These are going to make me feel happy. And what if my neurons can't make as many of those anymore because of stress? This is where the disease affects me. What are my symptoms going to be? I'm sad. This is what we call depressed. Okay? I have depression. Or sometimes, if I don't make enough dopamine, I feel anxiety. I can have disorders that affect my mood. They give me depression, they make me irritable and angry, they give me anxiety. But all of this is due to physiological changes in our neurons. That's what diseases of the brain are. When you talk about schizophrenia, schizophrenia is due to physiological changes in the neurons in a person's brain. Bipolar disorder is physiological changes in the neurons of a person's brain. That's what depression is. We don't make enough neurotransmitters anymore, so we have physiological changes in the brain, and we see the symptoms from this. Psychology is nothing more than studying the physiological changes in a person's brain. And what we're learning today is what I think in my brain, what I perceive, can change my entire body. So I love it as much as I hate it when I hear medical professionals say, oh, it's all in their head. And I look at them and I go, no duh. Where else do you think it's going to be? In their foot? Of course it's all in their head. That's how we think. But here's what they lose. They lose the fact that this controls this. Okay? If it's all in my head, it can make physiological changes in my entire body. So no kidding. What I think becomes what I feel. Look at, for instance, a person who's stressed out. Husband and wife, they're stressed out because they want to have a baby. And she can't get pregnant. Nothing wrong with them physiologically. Gone through all kinds of tests. Everything seems to be fine. But they want this baby super duper duper bad. Well, guess what? Cortisol levels are up. And when cortisol levels are up, you can't ovulate. Now, she just thought herself into not being able to get pregnant. But now here's what happens. They finally, because no doctor is smart enough to tell them this, because by the way, what I'm teaching you today, they don't learn in medical school. Okay? You go to any medical school in the United States and they do not get this lecture. So you're probably going to know more than the doctors you work with, which is okay. You just need to school them gently because they're really not good at listening. Okay? So she finally agrees, let's adopt. They get a baby, and 9 months later, they have another one. Because guess what happened? Cortisol just went down because they brought that baby home with them. And now all of a sudden she ovulates, bam, they're pregnant again. Happens all the time. All the time. Matter of fact, I have a very close doctor friend whose wife couldn't get pregnant. And I kept trying to tell them, you guys need to stop stressing out about this. Just go have a vacation in Hawaii or something. Stop stressing out. Sure enough, 5 years later, they finally got their baby to adopt. 9 months later, they have their second son. Happens all the time. So now let's look at this just for a quick second. If it was you, and you're trying to pinpoint in this whole cascade, where's the best place to stop the stressful effects on the body? What would you say?
The perception of stress.
Yeah, the perception. Look, this sucker started the whole thing. I perceive I'm under stress. Now remember, it could be consciously or it could be subconsciously. They may not even know they're perceiving stress, okay, which is really important. So how do you then help your patient? What do you think is the best way to help them with this perception?
Talk about it.
Talk about it. Okay, that's really good, and I like class yesterday and today brought it up. You talk about it with them. Don't send them somewhere to talk about it. You do it. This is one of the biggest problems in the medical field right now. You get a patient in and out in like 15 minutes because y'all need to make money. Okay? You need to have some compassion for these patients. You need to be able to look at their face and know who they are and know if they're married or if they have kids or something about them. They need to know you care. That's why they're going, as well as the fact that they're sick. They need to know you care. If you're not going into this whole field with some compassion, then you need to get the heck out. Because the rest of us, we don't want you there. We want doctors and nurses, especially nurses. We need you to be compassionate. We need it. Because here's what happens. When you walk into my room and I'm in my hospital bed and you are compassionate towards me, I am less stressed. I can heal better. You just did the best healing technique you possibly could do for your patient because you actually took 2 seconds to care. It's really important. We know that that decreases stress levels when people are compassionate and friendly and smiling. Smile. I see nurses walking around wards like this, and I'm thinking, honey, you're making 6 figures. You should be smiling. Do you remember where you came from? Okay? That should make you smile every day you go to work. Just that. You're making a paycheck. Okay? You didn't used to. That's important. You know that diamond 2 or 3 you got on your hand and that Bahama cruise you're going on? That should make you smile. And that should make the patients happy too. Very important. You don't want to just send them away to talk to somebody. Give them 2 seconds of your time. You know, typically you people go into nursing because you are actually very compassionate people. Most people like myself who are not compassionate, okay, and I know it. My kids yell at me all the time, you need to be a little more compassionate. I'm trying. Okay, get off my back. Real compassionate towards you. No, I'm just joking. But I just don't have that kind of compassion. It's just not who I am as a person. And usually when you go into nursing, you're very compassionate. My mother was a nurse for over 50 years. And she worked in the psychiatric wards mainly. And she is an extremely compassionate person. The moment you see my mother, the first thing you would say without her even saying a word is, oh, she's very compassionate. It just oozes from her. Skipped a generation. Okay. Like baldness, just did. Okay? So that's really important. Now you can also send your patients, because obviously you don't have time to spend hours talking to them, and you're not trained either to do it. Okay? And you send your patients to therapists as well. Not psychiatrists. A psychiatrist is to help the patient with a serious medical disorder. Psychiatrists do schizophrenia, they do bipolar, they do work with people who have serious, serious disorders. Usually your patients who are stressed out are like you and me. You know, their mom's giving them a hard time, they're in school, crap is happening, life is hard. They just need somebody to talk to, and that's typically what your therapist is all about. For instance, like marriage and family therapists. They do therapy about families and what's going on in your marriage and your normal everyday stress that all of us go through. What else can you do for your patient to attack this problem? Perception, super important. What else could you do? Because isn't this the most important thing? Try to nip it in the bud. What could you suggest to them to do?
Maybe things that help them relax or cope with yourself.
Okay, maybe hobbies, relaxation techniques. Okay, excellent. What else? What else could you do for them? See, you probably don't even know because you're so stressed out. What else?
Isn't it when you like touch patients or give them a hug or put your hand on their shoulder that kind of lets them know they can trust you.
Absolutely. Absolutely. Touch is very important. Yes, so if you're just patting somebody, you know, trying to be compassionate, absolutely. Very important. That's why I like when somebody touches a dog in the hospital, their blood pressure goes down. You know, they're petting that animal. We see blood pressure drop dramatically when they're petting a dog. Most hospitals bring dogs through it every day now because it helps the patient so much. It also improves the immune system. What else?
Could you explain this whole thing to them so I can understand it better?
You could. You could teach them. For many of your patients, that would be very helpful for them. You don't have to teach it in depth like this, but you could teach them something. Most of them have never heard this. What else? What about exercise? Would exercise work for anybody? Maybe. Maybe, because sometimes you got patients who are already so stressed out that if you say exercise, it stresses them out more, and now they're super stressed because they know that you're exercising and they're not. Okay. Take a break, okay? Try your best, okay? But if they can do it, look, it stops this response and that one. Doesn't stop the perception, but it actually can turn off the sympathetic nervous system, can turn off the release of these hormones. It suppresses that. That would be really nice for their body. Helps to relieve a lot of those symptoms. And then they might not be quite as stressed. Anything else? You know, your typical exercise, eat better, those things are very helpful, absolutely. Okay? But let me tell you, the #1 recommended by the American Medical Association way to relieve stress in your patient. Tell them to pray. Think about it for a minute. Whether you believe in it or not, if they believe in it, what is this doing for them?
Giving them hope.
Giving them hope. That's important.
Talking about their stress.
Talking about their stress
Keeping them
to
calm.
somebody they trust, right?
Wasn't it taking the stress off of them and putting it in God's hands?
Taking the stress right off of them. Look, dude, I'm stressed out. You need to take this problem. I'm done with it. Look at what it just did for them. It relieved them of the responsibility. It gave them the feeling that somebody else is helping them and taking care of them. And now they're... Works pretty well. Especially when they believe in it. So this is why it's highly recommended. And again, I don't care if you believe in it or not. That's not the important thing. You're not doing it. They are. Although maybe you should, because you're going to be stressed out too, because you see the picture I put up there, right? That's you. Just want to make sure you know, okay? And of course, this is what we want to prevent. Only for Halloween, not in real life. Any questions? All right, now be aware that this is a possible essay on your second exam.